All right, good morning, everyone. The time being 9 a.m., I'd like to call the Public Service and Judicial and Public Service Committee to order. My name is Myrna Molina, and I'll be your chair this morning. If I can have a roll call, please.
Brown.
Here.
Gums.
Gums here.
Leonard.
Here.
Sanchez.
Here.
Shepro.
Shepro here.
Davis.
Davis here.
Molina.
Present. Okay. And I would like a motion and a second for the approval of minutes for December 10th.
So moved, Shepro.
So moved by Mr. Leonard, second by Mr. Shepro. Any
Since I
comments,
wasn't there.
discussions? Can I have a roll call, please?
Brown.
Here. Yes.
Gums.
Gums, yes.
Leonard.
Leonard, yes.
Sanchez.
Yes.
Shepro.
Yes.
Davis.
Davis, yes.
Thank you.
Thank you. Okay, next item on the agenda is our monthly financial reports. I believe Ms. Wagner is here. Good morning.
Morning. Good morning. The December finance reports are included in your agenda packet for review. In the general fund for fiscal year 21, the coroner's office is currently trending over the recommended budget amount in commodities, and that's currently due to items that are attributed to the COVID account. So as long as those items are approved as COVID related, they will be reimbursed by the CARES Act funding, and that should rectify itself going forward. So we'll just keep an eye on that as well. I just wanted to also point out on your agenda this morning for consideration is a fiscal year 20 budget adjustment for the coroner's office, and be happy to answer any questions that you might have regarding our reports.
Thank you. Any questions for our for Erica? No questions? Okay. Thank you so much, Erica.
Thank you.
Okay, next item on the agenda is our state's attorney. Good morning.
Good morning. Thank you. So I am going to report on some preliminary statistics that we have for 2020. We should have the formal statistics out in February. From 2019 to 2020, our felony filings did go down about 7.2%. We believe that that's directly related to COVID and due to the shutdown. So we were trending up in terms of our felony filings. And what you could see and what you will eventually see is that we were relatively normal in terms of our filing from January through March. There was the slowdown this summer and we went up. Our December was particularly violent. We had a number of shootings. We had a number of homicide cases. We had throughout all of 2020 some murder-suicide. So we're really looking into this to see if it's more than just related to the pandemic. There's domestic violence trends that are going up. Our misdemeanor domestic violence cases actually went up 3%. And so that's important to note because if essentially we're going down in terms of our cases, some of our most violent ones and the ones where people are in the most danger are obviously the ones where they're living in the home with the abuser. So again, it's something that we're working with our police departments in regards to that. We were able to collect about $25.3 million in child support this year. So obviously that helps the people in Kane County. For all of 2020, we had 16 homicide victims. We authorized first-degree murder charges against 12 people in 10 cases, including one that was a cold case from 2017. We authorized involuntary manslaughter charges against 2 defendants. We still have 7 homicide cases that remain under investigation. In addition to that, for the personnel for the state's attorney's office, we have been hiring so that we can get up to the capacity of where we should have been. We have 3 new prosecutors starting February 1st, and those are also 3 prosecutors who used to work in our office, so they're coming in with experience of having been in this office. So that is helping out. We have seen in our office that the prosecutors have been doing 2 to 3 jobs at a time. So they're working their courtroom and they're also working other portions of our office. So for example, right now I am on our felony review. So I'm attending this meeting, and if somebody calls with felony request, I will step out to take care of that. But we're working on that. We have a proposal that will be coming to everyone soon in regards to additional staffing needs. Other than that, I have to say that I work with the greatest law firm, which is the people within my office. These prosecutors have been fantastic. They worked hard for Joe McMahon, and they're all doing the same now with me. So that is our report.
Thank you so much. Any questions? Any comments? No. Okay, thank you. We appreciate that. Okay, next on our agenda is our sheriff.
Good morning, everybody. I'm going to save you all my infamous PowerPoints and just run through some bullet points over the year. So for COVID in the jail, we're back down to only one new positive case. So we're just about to wipe it out of the facility, which is exciting for us. And of course, that has an impact on our state's attorney court services and the judges if we can't properly run hearings while people are on quarantine. So we are almost back to normal. We're excited to report. The health department is still, we talk to them on almost a daily basis to make sure we're doing all that we can. This is outside of all the vaccine work we're doing with them right now. Just getting their advice on jail operations during COVID. They do want us to continue testing twice a week, which is going to have a severe financial impact on us as CARES Act money has pretty much ceased. And now we're having to fund that out of our own budget. Just by way of comparison, one 3-month iteration of testing for 500 people, that's the jail staff and the detainees, came to about $300,000. So it's not cheap whatsoever. I have to echo the state's attorney's concerns about public safety. We continue to see an increase in domestic violence. We had a very active December, but I have to give extreme credit to my staff for all of their work. They stay on the job until the job is done. We had a shooting on Christmas Day that started at 9 in the morning. The shooting happened about, no, I'm sorry, I'm thinking of a different incident. That happened about 2 in the afternoon, and by 9 p.m. that day, they tracked down the suspect and had him in custody. Great deal of evidence recovered. And State's Attorney Mosser was actually the on-call state's attorney that night and approved the charges. So we appreciate her for that. We then had a SWAT call out in the same area in an unincorporated Aurora where a gentleman pointed a rifle at 3 of our deputies when they went to serve a arrest warrant on him. That created, of course, that SWAT call out. Thank God for our armored vehicle. We were able to put that right in front of the house and coax him out without anybody getting hurt. And when I go back to that domestic violence increase, we're so happy to have that social worker that I introduced you to last month. She's already got 70 cases on her plate now from all the activity over the last month. And she's doing a great job networking with all those families that need help. We should be publishing our annual report for 2020 within the next couple of weeks. I'll give a quick overview of that in February JPS. We are forecasting for, and this is always what we do at the Sheriff's Office, we expect the worst and hope for the best when it comes to any unrest leading up to the inauguration period. We are considering the inauguration period Sunday through Thursday in cooperation with our area partners. So we established the Fox Valley Metro Area Command, and that includes Elgin, Aurora, my agency, Kendall County Sheriff's Office, and Naperville Police Department. And this was built back in June when the unrest began, and we have a really good cooperation and plan in place to go forward. I am hosting a 9 a.m. meeting. I think everybody in this room that's a department head or office holder got that invite just to run through our high-level plans for police coverage and response and some safety considerations for all of your offices over the next week. As far as this building is concerned, I know a lot of people are concerned about the government complex. We did add on to our treasurer's detail, that deputy you see down at the door. Next week, there'll be 2 of them. I'm not comfortable leaving just one man there if there's specific threats on government buildings. And we've increased our patrol coverage during the daytime when unrest is likely to occur. From Sunday through Wednesday, we'll have 4 deputies plus an extra supervisor out. So good luck to CANCOM in handling all that radio traffic. I am about 95% through parsing through the 764-page police reform bill that just got passed. I'm a fan of some of the things. I'm incredibly concerned about some others, and in police officer retention, recruitment, and the extreme weight that's been placed on law enforcement by this bill. And my overarching concern is law enforcement was not consulted, law enforcement leadership, in the development of this bill or the voting on it. Of our local legislatures, none of them reached out to me. I had to proactively reach out to all of them, and I only heard back from about 40% of them. So that to me says a lot about the respect for law enforcement in the region here. So we'll continue to push for it. I know the state's attorney is going to parse through it as well and put our notes together and see how we get through this, as we always do as one team. And then I do have 4 resolutions up for consideration.
Thank you. Any comments on his report? I did have I guess I wanted to make a comment first. Sheriff Payne, if once you kind of have a review of the criminal justice reform, it hasn't been signed yet, so I don't know what the timeline is for the governor, but if we can put together some kind of summary of what your concerns are, along with our state's attorney's concerns, and kind of give us an update if there's anything we can do on our side, just so that we're open. We might not be able to discuss things with the state legislature, but amongst ourselves, I think it's important that we keep that open and, discuss what your concerns are with it, because I think it is very important.
I appreciate that.
Okay.
It will have a public safety and financial impact on the county. So we'll get that out as soon as we can.
Madam Chair.
Mr. Leonard raised his hand first, Mr. Shapiro, so let me allow him to speak.
Thank you, Madam Chair. 2 questions I'd like to ask, or statements I'd like confirmed from Sheriff Payne. Sheriff, you hired this new social worker, and obviously that was in your budget. You had the money to do that. And the cost on that was approximately, on an annual basis, was it about $70,000 or $80,000?
Her salary is $60,000, and I couldn't tell you right now what she selected for insurance. Obviously, that's going to have a range from $10,000 to $24,000.
Fine. So, we were pretty well aware of the fact that it'll probably be about $75,000 or more, and I thank you very much for working that into your budget. My real question was, I wanted to make sure I understood correctly. You were talking about testing. How often do they require you or ask you to do the testing? And the $300,000 figure for 500 people being tested, over what period of time is that $300,000?
It was about $100,000 a month is what we can expect if we're testing twice a month.
So it's twice a month, about 100,000.
Or I'm sorry, 2 times a week for the entire month.
Oh, okay.
Yep.
So that is an additional expense that, since we don't have any more CARES money, we're going to have to find a solution to that also, which obviously we have to do.
Okay. Like we've historically done, thank you for that, Mr. Leonard. Like we've historically done at the Sheriff's Office, we've been trending far under our corrections budget, so we're comfortable for now. But if they continue that guidance, we need to do the best that we can. If that's our public health officials' opinion, that we need to continue that. So I'll throw up the red flag if it starts becoming an issue.
Thank you very much.
Thank you. And along that line, Mr. Leonard, what is the CDC guidance once our corrections officers and our first responders receive the vaccine? I'm not sure how many, I guess maybe I'll ask you, how many of our of the people in your department have received the first dose of the vaccine? And
So only our medical staff inside the jail has received it. We are planning to move into phase 1B on January 18th. So that is right around the corner. In working with the health department, they've committed to not just our first responders, but also our detainees. They've set aside enough for them to get it because of that gigantic congregate living facility. So hopefully in the next 2 to 3 weeks, we'll have our first round.
so that would mean between the first and the second is 21 days, depending on the vaccine. So would we still be testing everyone after that point? I don't know what the CDC guidance is on testing after you're fully vaccinated.
At this point, no. We are suspect that if somebody becomes symptomatic, they're going to want to run tests again and run tests on everybody.
So hopefully we're able to do that within the next quarter and
Fingers
we don't have
crossed.
to worry about too much.
Yeah.
Okay. Thank you. Okay, Mr. Shapiro, thank you. Go ahead.
Shepro, thank you. Sheriff, I'm not going to ask you detailed questions about the bill because I think we're all trying to get through it. But I noted that it was passed without a fiscal note from the General Assembly. And I wondered if, as part of your analysis, you may be able to shed some light on what additional unfunded mandates are going to be imposed on your office as a result of this bill.
So great question. The primary unfunded mandates are going to relate to training and continued education. For the first round, when a first deputy sheriff or police officer is first hired, and then that continuing education for years after. Fortunately, we did get our body cameras in place, which is a mandate under the law. There is the only provision that I saw from the state, and it doesn't give a dollar amount, for financial support is for body cameras. And it does suggest that the Illinois Criminal Justice Authority does have the power to use up to 10% of their budget to help agencies buy body cameras, but that is the only indication that any mandate will be funded. And it's not a
Thank you.
shall. It's not a shall, it's a may.
Yes. Thank you.
Okay, thank you. Any further questions or discussions regarding the report? Okay, if we can have a motion and a second to discuss first resolution of the budget adjustment. Moved by Mr. Brown, second by Mr. Sanchez. Sheriff Hain, go ahead.
So at the request of the occupants of Building A here, we've had the deputy stationed at the front door of Building A since about June for COVID and security concerns. CARES Act was covering that expense. That is, of course, stopped. So I worked with county finance to move a budget adjustment into the sheriff's office budget. This is an overtime detail. These are not regularly working deputies that are stationed out there. So this just allots us the overtime amount for the next 6 months until they get some new building security measurements in place.
Thank you. Any discussion? Okay, please call the roll.
Brown,
Yes.
Gums,
Gums, yes.
Leonard,
Leonard, yes.
Sanchez,
Yes.
Shepro,
Yes.
Davis,
Davis, yes.
Thank you. Okay, the second resolution is approving the purchase of 4 replacement vehicles. If I can have a motion and a second, moved by Mr. Leonard, second by Mr. Sanchez. Sheriff, go ahead.
The sheriff's office tries to replace 10 to 12 patrol vehicles per year to keep up with our fleet. And this gets us about a third of the way through that. And then we have an additional budget adjustment coming actually later in this meeting to acquire the rest of our vehicles.
Thank you. Any questions? Okay, please call the roll.
Brown,
Yes.
Gums,
Gums, yes.
Leonard,
Leonard, yes.
Sanchez,
Yes.
Shepro,
Shepro, yes.
Davis,
Davis, yes.
Okay, thank you. Okay, I'll entertain a motion in a second for the
I'll
next
make a
resolution.
motion to approve the coroner's purchase.
Okay, moved by Mr. Shepro, second by Mr. Sanchez. Sheriff, please go ahead.
Sure. This is odd that the sheriff is bringing this resolution forward, but of course, 2020 was an odd year. So under the Emergency Purchase Authority, before the CARES Act Allocation Committee was established, the coroner had approached me about acquiring 2 vehicles for his staff that would keep decedents separate from his staff while transporting. Of course, right now, their vehicles, they're all in the same compartment. So that dramatically exposes his people to COVID. So to me, that was an essential purchase. I authorized it to get it moving forward. When CAC reviewed it, there was some miscommunication about it being a request and not an actual purchase at the time. So CARES Act Allocation Committee only approved 1 vehicle at the time, and then we stepped back up and reiterated there are actually 2 vehicles purchased. So what this resolution does is move money from reserves to cover that second vehicle instead of my budget or the coroner's budget.
Thank you. Any questions or concerns regarding this resolution? Seeing none here. Okay, please call the roll.
Brown,
Yes.
Gums,
Gums, yes.
Leonard,
Leonard, yes.
Sanchez,
Yes.
Shepro,
Yes, Shepro.
Davis.
Davis, yes.
Thank you. Passes.
Okay, thank you. Passes. Okay, I'd like to entertain a motion and a second regarding the resolution of transferring, making a salary budget adjustment. Moved by Mr. Leonard, second by Mr. Brown. Sheriff, sorry, go ahead.
Thank you. In analyzing county finances over the last 2 years, I believe there is a fair amount of duplication between budgets within this room. So this is a measure in conferencing with the state's attorney who inherited her budget from the previous state's attorney. She wasn't able to hire an essential position within her office, and that's the chief of the criminal division. So I found funds within our court security budget to move to her budget so she can make that essential hire to move her office forward.
And if I can explain, if it's okay, the structure of the office is you have the state's attorney and then you have the first assistant. For the last few years, the first assistant has essentially been acting as the criminal division chief. The problem is the first assistant, much like the state's attorney, has to be in charge of criminal justice issues as well as civil issues. So what Sheriff Hayne is graciously doing is allowing that first assistant to be freed up to do all of what her job actually is. Her name is Christine Baer. She has worked at our office for 23 years. She has worked in almost every division, and she truly is taking on the role of being the first assistant by, she's watching this meeting, I believe. She's going to start attending these. And the person who we have in mind to bring over as a criminal division chief is somebody who has worked at the DuPage County State's Attorney's Office and the Kendall County State's Attorney's Office. He has tried cases as simple as traffic offenses all the way up to homicide cases. He comes in with years of experience along with a lot of connections to the Attorney General's office so that we can get more assistance from the Attorney General's office to come and try really complex cases like our child pornography cases where there's a lot of intense computer issues throughout all of that. He would be a great liaison with the Sheriff's Department to assist in their complicated investigations as well. So I would like to thank the Sheriff for being willing to do something like this because overall it's going to increase the safety for our community.
Great, thank you. And I'll just say this is a great example of the partnership that I know that our judicial partners have. So any questions regarding this resolution? Please call the roll.
Brown,
Yes.
Gums,
Gums, yes.
Leonard,
Leonard, yes.
Sanchez,
Yes.
Shepro,
Enthusiastically, yes.
Davis.
Davis, yes.
Thank you.
Thank you. All right, our next item on the agenda is our judiciary and courts. I believe Chief Judge is here. Good morning.
Good morning, everybody. A couple different things. First, I just wanted to start out by indicating that, as you know, we had Ms. Masser and Ms. Barrero that joined the team a month and a half ago, and I just want to reiterate how much fun we've had working together. This group has always been a group that's worked collectively to try to work in the best interest. They've joined right in. We've had a ton of meetings, and there's always a lot to do. But it's been a really good month and a half. And so I just want to say thanks to both of you and your staff. We haven't missed a beat. And with new people come new ideas, and that's refreshing as well. So it's been a really good month and a half. In the court system, the biggest thing, and it has continued to be the biggest thing, is how do we continue to move cases with trying to keep our employees and everybody that comes in safe. We've been doing that successfully with the help of, I can't even say with the help, because of IT. Without IT and without the IT department, it wouldn't be possible. And again, throughout the state, they look to our circuit as we relate to cooperation and the different things we've done with our computers, with the owls, with live streaming as examples of what the IT has done to really make this work. So right now, remote day-to-day court is supposed to, we're supposed to be remote until the end of the month. We consulted with the Kane County Health Department. We looked at the different factors. And so I'm going to be putting out a general order this Friday that's going to continue the remote hearings for another month. So we will remain status quo through the end of February. And we did that upon a lot of reflection and trying to figure out what we're doing now is good. In my personal opinion, it's not as good as being in person, but it's what we have to do right now. And we're successful in keeping things moving. But I look forward to the day that we're back in court. Next up is jury trials. One of the things that we've really been focusing on is we've been working with the sheriff and the public defender and the state's attorney on our jail population. And one of the things that we've identified and one of the hardships of COVID is we've had people that have been sitting in custody for a long time, unable to get their cases to trial. And so we consulted with the health department and we have made the decision we are going to restart jury trials on January 28th. We do so, and the very first step was working with the health department to say, can we do this and can we keep people safe? And they met with us and they said, yes, you can, provided that we continue to do all the things that we've done and the planning that we've done throughout this, which is temperature screening when people come in, making sure the COVID questions are asked, maintaining social distancing, giving people access to hand sanitizer stations. We're doing all that, but we feel when we balance everything that in order to keep the jail population, in order to give people their day in court, defendants, victims, we need to do this. So starting January 28th, we'll have those jury trials recommencing. And we're going to just take it week by week with the hopes that we're going to be successful in doing it. If we can't be successful or we don't feel like we can be safe, then of course we'll go ahead and continue those. But right now we're on track for the 28th. The next thing I want to comment just briefly on was the reform bill that was passed. The one thing that I wanted to comment on is because of the length, we're all doing the same thing. We're trying to go through it and we're trying to understand it. Two of the major things that I think are going to impact the county is the cashless bail system and also then body cams. One good thing about the legislature is they did listen. The chief judges throughout the state worked with the Illinois Supreme Court, and initially the effective date for the bail system was supposed to be effective upon signing. We indicated there's a lot that we have to do to plan for that, and fortunately, they did change the effective date until January 1st of 2023. So that will give us time to prepare. I haven't talked to the sheriff about this, but in review, I think that the EHM program that the sheriff has figured out a way to get back running is going to be something that we're going to really have to use much more than we are right now. So that, of course, is something that we have time to plan on. The other thing that I want to bring up, and I know that there's some new members to this committee, but one of the issues that we've talked about is body cameras. I think we all agree.
The sound of progress.
Yeah.
Is somebody cutting timber?
But with body cameras comes storage and comes review costs. And so one of the things that the state attorney's office and the public defender's office, and we have talked about, is with body cameras, you have to download that information that has to get transmitted over to the state attorney's office. It then has to go from the state attorney's office and it has to be stored. After the storage, it has to be transmitted to the public defender's office. And then the public defender's office has to figure out a way to have their client review. And so there's a couple issues there that we're going to have to plan for. One is increased storage capacity. And two, one of the difficulties is every police department uses a different system. And as a result of using that different system, it gets difficult for everybody to be able to utilize it in the same way through that process. So again, I'm optimistic. We're going to get through it, but there's a lot to go through and there's a lot of planning to do. So I'm very thankful that the effective date is put off so that we have time to get ready for that. And then finally, the one thing, again, the cooperation between the sheriff's office and the state's attorney's office with that position, it's great. What I always want the board to remember is the public defender's office. The public defender's office is under the umbrella of the chief judge's office. And anytime you add staff to the state's attorney's office, you have to remember that on the public defender side, same type of situation applies. So I just want to, again, remind, it's a reminder to me, but we always have to be looking out for the public defender's office. We have to remember that increased staffing at the state's attorney's office doesn't directly translate, but it is something that we have to consider and something that I'd like to continue that discussion as we go forward. So any questions on anything I've talked about? Great, thank you very much.
I got a question.
Yeah. Mr. Shepro?
Yeah, Judge, is the body camera also delayed till January of 2023 or just the bail system?
You know what? I did not look at the body camera language. We were really focused on the bail system. So I'm not sure of that. And we'll get that information for you for sure, but I'm not aware of the effective date. I think it may be 2025 if I read the Tribune correctly today. So we'll follow up on that for you.
Thank you.
Chairman Molina, Davis with a question.
Go ahead, Mr. Davist.
And I apologize for springing this on everyone, but since we have this collection of talent all in one room, years ago, we started to look at the possibility of a neutral exchange site. And it never came to fruition. I know we have the children's waiting room, but as we go through all of the things, in the world today, that's still an element that exists. And with domestic violence perhaps on the rise and a lot of tension in the air and so forth, children that are involved in those situations shouldn't be forgotten. I'm hoping that somewhere in the room, I'm not sure whose area this would be, but since I have the chief judge standing there, I thought I'd just bring this up so that we can maybe put it on a list to revisit and consider the possibility of finding a way to have a neutral exchange site for Kane County.
So, Mr. Davos, I can just tell you that we'll put that on the list. Ms. Masser has a lot of great ideas about the domestic violence and the way that she's approaching those, and that obviously relates right to that. So we'll certainly follow up with you and then talk to you about your ideas and report back.
That's all I could hope for today. Thank you very much.
Okay. Any other questions? Thank you very much.
Thank you. Thank you, Mr. Davis, for that. I believe there is a resolution authorizing the transfer of funds.
Yes, Madam Chairman, Doug Naughton, Court Administrator. One of the things I'd like to just bring to your attention on this resolution, one of the things we left out, so I will be making a modification to this resolution, is the transfer of funds is for fiscal 2021. Missed it, sorry. So we'll make the change before the next committee meeting. What we're trying to do here, this is a result of Public Act 100-987. That was back in 2019 when there was a massive change in how the courts assess and pay out fines, fees, and court costs. This required the state's attorney, public defender, the clerk, the courts, and the sheriff's office to sit down and try to figure out where these monies would be going. Essentially, one of the things that happened, we reduced the numbers of different fines, fees, and costs from 177 different accounts down to approximately 143. But there was completely new formulas that we had to apply, and we did that. We passed Resolution 19-154 in probably May of 2019, and we messed up on one account. It was civil filings, and it had to do between the children's waiting room and court security. We put in the wrong formula. Suddenly, the children's waiting room got much more money. Court security income dropped. And last year, or earlier this year, we made an adjustment to fix that back in March. And our intent was to come back in April or May of this year, and then the pandemic happened and that kind of fell off the books. So we are back again to ask you to support the passage of this resolution so we can return the money that should have gone to Court Security Fund in the first place in the amount of $465,863. Return that to the Court Security Fund for fiscal year 2021. So we're trying to fix our error.
Okay, thank you. I guess can I have a motion and a second on this resolution? Moved by Mr. Leonard, second by Mr. Sanchez. Any questions? Any discussion? Okay, please call the roll.
Brown,
Yes.
Gums,
Gums, yes.
Leonard,
Leonard, yes.
Sanchez,
Yes.
Shepro,
Yes,
Davis.
Davis, yes.
You passes.
Okay, thank you. Okay, next item on our agenda is our Court Services Administration. Ms. Ost, good morning.
Good morning. Thank you. Like everybody else, I've been reading through the crime omnibus bill. Court Services is a very big organization. We have almost 200 employees. We do everything from juvenile detention and pretrial through probation and all of that stuff, as well as KCDC for psychological evaluations, fitness to stand trial, things of that nature. So in looking at this bill, there's not a whole lot in it that affects my department per se, aside from the pretrial portion. A lot of the emphasis of the bill was on actually the executive branch, and the sheriff has my sympathies on that because there's a lot there for his department. And there's also a lot when it comes to bond call and the pretrial process and handling defendants who go through arrest. Many people may remember that in 2016, we were the subject of a pilot program through the Illinois Supreme Court where they beefed up our pretrial services. And so that's what I want to talk a little bit about this morning. I don't have a resolution, but I just want to bring some people up to speed on what is the status of pretrial in this county. And my good news is that we're well positioned for this particular pretrial part of the bill. So it's not really going to impact my department per se a lot beyond the bond call itself. So we, as you know, we do reports every year on our statistics. I sent this out not too long ago. We're getting ready to do our reports for last year. But just so this committee knows, we process just over 4,000 arrests through bond call every single year. And so there are additional factors that the judges are going to have to consider. They're changing a lot of things. So it's going to mean a lot of retooling. It is going to have a bit of an impact. But when we look at the percentage of people who come through our bond call, we do a risk assessment on every single person. And by statute, it has very specific language about the things that we are supposed to be considering as part of a risk assessment. And the risk assessment for pretrial is specifically, are you likely or not likely to come back to court? And are you likely or not likely to commit a new offense? And so we've implemented something called the PSA, the Public Safety Assessment, and that's exactly what it measures. So we've already implemented that portion of it. And so when you look at the people that we have identified or through the pretrial process, through the risk assessment process, approximately 37% of who we process are high risk. So that's a high number and it requires a lot of supervision. Right now we have over 3,000 people actively being supervised on pretrial. That's the bad news. The good news is we know who they are, right? We have this instrument in place, we have the staff in place, and we have the procedures in place. So I'm hopeful that because of the robust work that we've done previously to beef up our processes, that we're going to be able to get a handle on this. It's not insurmountable. We'll be able to tackle this. But I want to let you know that it is going to be some change. And we're working on it, we're reviewing it, and we'll come back to the committee and let you know where we're at. But I want you to know that because of the support of this board, we've been implementing a lot of this since 2016. So it's going to require a few more tweaks, but we'll get there. And that's really all that I have to report at this time.
Thank you so much. Any questions for Ms. Ost?
Okay, thank you.
Thank you. Okay, so next on our agenda is the Juvenile Justice Center. Mr. Davis?
Good morning. I do have one resolution for your consideration regarding mental health services for minors.
Okay, I'll make a motion in a second. Mr. Leonard moves to discuss and Mr. Sanchez seconds. Okay, please go ahead.
So those of you that have been on this committee for a while have heard me talk about the challenges of getting our kids appropriate mental health services, especially over the last few years. A lot of what our mental health clinicians do in our building is crisis intervention. Whenever we have a kid that we feel needs mental health services beyond what we can offer in our building, we have to call an agency that comes in and does a SAS evaluation. That stands for Screening, Assessment, and Support Services. The state contracts with different agencies in different counties to provide that service. So there's only one agency in Kane County that provides that service, and that's Elgin Family Service Association, or Family Service Association of Elgin. I've also mentioned that we previously had 2 mental health clinicians at the Juvenile Justice Center. One of our mental health clinicians resigned several months ago, and we've had a challenging time trying to find a replacement. So what this resolution is proposing is we plan to contract with Family Service Association of Elgin to provide mental health services for the kids in our building. It's actually I'm very excited about it because these are the same people who do the screening assessments for hospitalization. So they already have a relationship with us. They're already in our building. They're already involved with the juvenile court system regarding kids with mental health issues. So I think it's a very positive partnership. And again, they're the sole service provider for the screenings that we require to have kids hospitalized. They're also able to bill the state for crisis intervention services and some case management services, which makes the cost of contracting with them a lot less than what we were planning to pay another mental health clinician. So that price comes in at $22,200. So I'm asking that you would approve this resolution.
Okay, thank you. Any questions? I guess I just have one. Is this regardless of the amount of assessments they do?
It is regardless of the amount of assessments.
that's wonderful.
That is going to be a flat rate for us.
Okay, wonderful. Thank you so much. Okay, if I can have a roll call on the resolution, please.
Brown,
Yes.
Gums,
Gums, yes.
Leonard,
Leonard, yes.
Sanchez,
Yes.
Shepro,
Shepro, yes.
Davist.
Davis, yes.
Okay, thank you. Okay, this resolution passes. Next on our agenda is our CaneCom. Ms. Guthrie, good morning.
Good morning, thank you. For December, for CaneCom management, it's been extremely busy working on our Starcom encrypted Motorola project. This has been a focus for the last couple months, and we're working on our radio council configuration, as well as coordinating with our subscribing agencies and neighboring 911 centers on our portable and mobile radio configuration. So we're moving along with that project. In addition, our focus has been on hiring and training our new telecommunicators. And just another important item to note, we are the after-hours answering point for the health department. When the health department is not there during business hours, the phones ring directly into CaneCom. As you can imagine, with news about vaccinations, we've received quite a few calls. So we're working with the health department on that, but I think since the first of the year, it's been approximately 200 calls. I mean, it was climbing during the pandemic, but there's a lot of public interest. So we're receiving a lot of those calls. So we're working with the health department on different options. I believe that is all I have for our monthly reports. I plan to bring our annual report to next month, as well as additional details on this Motorola project.
Okay, wonderful, thank you. Any questions for Mrs. Guthrie? Thank you so much.
Thank you.
Okay, our Merit Commission.
Good morning. Our yearly report is on file, and I just wanted to take an opportunity to explain a little bit about the Merit Commission itself. My name is Todd Zeese, and I am with the King County Merit Commission, and I wanted to explain a little bit about what our responsibilities are. There's three main responsibilities for us. And I thought that this might be helpful for some of the new people that are on, that if we do this every year when there's changes in leadership might help. The three main responsibilities of the Merit Commission is to provide a certified eligibility list to the sheriff for corrections and patrol officers. These lists are usually for 2 years. However, depending on the number of applications, this list may expire earlier than 2 years. Aptitude testing and interviewing are conducted for these lists. The second is to provide an eligibility list of qualified candidates for promotions of sergeants and lieutenants in both patrol and corrections divisions. This list is also acquired through testing and interviews by the Merit Commission. We also handle discipline, and upon written request, the Merit Commission may review suspensions and discipline imposed by the sheriff from the employee. As a committee, we can affirm or either increase or decrease the suspensions days imposed. The Merit Commission also has the authority to discharge, demote, and rank, or suspend merit employees for more than 30 days once the written charges are filed from the sheriff and following a hearing. So if you have any questions about our year-end report, I can answer them now. But if not, I'll see you in a month.
Thank you, Mr. Zeese. Any questions? Okay, thank you so much for your time this morning.
Thank you.
Okay, next on our agenda is our circuit clerk, Ms. Barrero. Good morning.
Good morning. My report is in the file. but I do have a couple things to go over with the report. We had some computer issues at the beginning of the week, which I'm sure all the judicial partners are aware of. And we are addressing those issues currently with IT and our staff. It is involving our ecosystem, and there is a lot of work to be done on that, but we are all working together to try and come up with solutions so that the courts won't go down. They were down for a little while on Tuesday, and that's a huge disruption for the whole county. And I don't think the public actually understands that these systems are run, yes, through our office, but all of us use them. So it kind of falls on all our shoulders. So the next thing is collections for the month of November went in December for the amount of 1,357 cases. That's a huge amount. But what we did, I believe, is that's almost 2 months of reporting. The total dollars that we received in November from collections was $144,410. Now, for the whole year, we've collected $1,431,180. $1,431,189. Now, you have to understand that through collections, we use 2 different systems, which I don't think was ever addressed to this committee since I was on the committee prior to this. But we use 2 different systems. We use a company, attorneys from Chicago by the name of Harris and Harris. And then we also use the Illinois comptroller. Now, what happens is after 1 year, Harris and Harris sends a report to the state comptroller, and then they also try collecting on those same cases. So we have 2 different entities working to collect for us, which actually is a good thing, because then in May, it's a bad thing for those that owe money, and it's a good thing for us, because what the state does then is it captures from their income tax. So we get our refunds through that. And so we'll usually see a big jump in about April. A large increase will come in. Currently, revenues are still down 45 to 50% daily. That's about $20,000 a day. We collect revenue for pretty much the whole county in terms that go into the general fund and special funds, and our revenue is considerably down. We are very busy at our front counters, but it's just getting reports. It's not, nobody has any money to pay, so it's unfortunate. The other thing is in January, we only had 2 people out with COVID, which is great because we have 100 employees. We're still continuing to keep our staff down to 47. We have a rotating schedule throughout all our departments. And in December, we had a couple drives. I think I mentioned it, that we were having a Toys for Tots drive. We collected 75 toys in a 2-week time frame for Toys for Tots. We collected 104 pairs of socks that were delivered to Lazarus House in Elgin. And we also did a Christmas card collection for nursing homes, since nobody can go to a nursing home. There were several throughout the county that accepted Christmas cards from us. Our employees took time out of their days not at work to bring in Christmas cards, and it totaled 606 residents received a card from us at the county. So I thought that was kind of nice. It spread a little joy for those that they can't see anybody. It's kind of sad. And then the other thing is, the chief judge mentioned the cash bail issue, and we're going to see that'll affect the revenue that the circuit clerk's office brings into the county by at least 10%. So that's another thing going down the pike that we need to pay attention to. It's 2023, but it'll be 2023 tomorrow before we know it. So we really need to look at our revenues and our spending revenues throughout the county, that this money actually helps pay. And that's all I have.
Great, thank you. Any questions? Thank you, appreciate it. And thank your employees for the cards and everything they've done to spread a little cheer this season. It's been rough on everybody.
It was really a great little plan. And the whole idea was if you have 10 cards left over from when you sent out cards, could you just, write your name on them, say just your first name. And we sent them out and we had somebody that did it. And it was phenomenal. We called the nursing homes to see if they'd accept the cards. And then we got how many residents per nursing home. So we could determine, so we weren't going to bring 20 cards to a nursing home so that everybody in those nursing homes received a card.
Wonderful, thank you so much.
Welcome.
Okay, now, next item on the agenda is our public defender. Ms. Connett, thank you. Good morning.
Thank you. Good morning. We are going to be preparing our year-end report that we will share with everyone, and that should be coming very soon. Just to kind of give you a little highlight of our year. In 2019, we opened 9,408 cases in our office. In 2020, we opened 7,146. So you can see the impact that COVID has had on the amount of cases that we have opened. However, surprisingly, in the amount that we have closed, in 2019, we closed 8,824. In 2020, we were able to close 5,680. So I think that speaks very highly of our attorneys and not only our attorneys, but our staff as well in our office, how hard they have worked this year, despite the conditions that we have been under the shutdown and now fully remote. They have been able to, and I know that I have talked about this many times before, but just their ability to adapt and to try new things and to do anything that they can to help their clients. And also our support staff who has worked tirelessly to make sure that the attorneys have what they need and to get the discovery opened and to the attorneys so that they can continue to work from home. So I am very proud and very pleased to see how much work that we were able to do this year in these conditions. One thing that I did want to highlight that I know I have talked about before also is our abuse and neglect court. In 2018, we opened 76 cases in that courtroom. In 2019, that number rose to 124. And in 2020, it has rose to 218. So clearly, as I have indicated before, that is a courtroom that continues to increase and increase at great strides. We have one attorney over in that courtroom. And as I mentioned last month, we did lose that attorney after 10 years. So we did have to transition to new staff over there. Jenny Amato started in that position on January 4th. It has been a very seamless transition and she is doing a great job there, but she does come into a very heavy caseload and a very busy call. She sent me just so for my information, a snippet of a schedule that they had one day this week. And from 9 to noon, they have cases every half hour. There were 2 permanency reviews, 2 adjudicatory hearings, 2 disposition hearings, and they did a shelter care. And that's just in one morning. So they are very, very busy over there, both the state and the defense. As to our felony caseloads, currently our numbers, the highest client caseload is 92 cases for an attorney. Our average is in the 80s. So there is still the backlog that we're working through based upon the shutdown. However, we are hopeful that going back to jury trials will start to kind of alleviate that backload a little bit. Finally, I know that everyone has commented on the reform bill. I also am in the process of going through it. It is a very large amount of paperwork to go through. I do thank the Chief Judge for mentioning us as what I can see from this bill so far is it is going to increase our support staff workload at the very least. I am not fully through the bill, so I can't comment fully, but I do believe that not only for the state, but for us, it will increase our workload in regards to how much discovery that we get and our ability to open that discovery on a timely manner. Certainly, those will be discussions that I am sure we will have a lot of in the next coming months and years as we all get through it, but just wanted to mention that at this time. Thank you.
Thank you so much. Any questions?
Yeah, Madam Chair.
Yes, go ahead. Mr. Shepherd?
Question. Could you comment on how the caseload for your staff compares with some of the offices in our neighboring counties?
I do not have numbers specifically. I have spoken to public defenders in DuPage County as well as DeKalb County. We have the same conversations about the backload and trying to get through the backload of the cases. I certainly can try to obtain some of those numbers and get those to you, though.
My impression is that you're carrying higher caseloads than most of the other collar counties, but
that could very well be the case. I know in the past, ours were higher than other counties. I know because of the forward movement that we have had in our county, I think that we have done a better job of working through some of our cases during the shutdown and fully remote. So I would not be surprised if at this point, if some of the other counties were a little higher than us, just because they have not been as forward thinking and have not utilized a lot of the technology that we've been able to utilize here in this county.
thank you.
Mr. Chairman, can I make a comment?
Yes, please, go ahead.
Just on the abuse neglect, just so that I just want to bring everybody up to speed, but the abuse neglect courtroom is, those cases happen when DCFS has to go in and help the family, either because the kids in that family are either being abused or neglected or there's another situation. What I want to point out for planning purposes is DCFS has made a transformational shift. So when you go back to 2018, and this isn't the abuse neglect cases, it's just their appointments. But in 2018, DCFS had a policy of not wanting to refer cases to court. So what they tried to do is work with the families to try to keep the families intact, and only when they had to would they go to court. So the case numbers were very, very low. Then many of you may be familiar with the A.J. Fruitt case. He was the child who was murdered by his parents. And when that happened, ultimately 2 DCFS workers were even charged in that case with being neglectful in that situation. But what you saw was DCFS take a policy change, and instead of trying to keep cases out of court, they did a complete 180, and now they're referring almost everything to court. So the end result for the court system is when you look at the appointments, and again, Ms. Conant said 78 in 2018 and now 218. When you look at that, that's almost a 300% increase. And planning wise, we don't anticipate that that's going to go back down. What we anticipate is that this is going to continue. So on our end, Judge Karianis is our judge that's in that courtroom. As Ms. Conant talked about the schedule, they are in court from 9 a.m. to 4:30. And when we talk about court and remote court, they have to bring in DCFS workers. They have to bring in the parents. They have to bring in the attorneys. So without the IT department, this doesn't work. We have 10, 12 people that are coming in, but as a result of all those people coming in, they're at a breaking point. And so what are we doing? What we're trying to do right now is we're doing a couple things. One is we're going to look at those numbers again in June to see if what we anticipate is going to play out to fruition. So if we get to June and we see that we're back to these same levels in the court system, on my end, we're going to have to make a change. We're going to have to try to add and take away from another area and assign a judge to help that courtroom. If we do that, then that means that we need to be able to staff those courtrooms with ASAs, with PDs, with circuit clerk, with deputies. So it's not anything that we take lightly, but I just wanted to give you a little bit of a foreshadow as to how we're trying to plan for this. And again, our feeling, not only my feeling, but the chief judges throughout the state, our feeling is DCFS isn't going to pivot on this. So this is the new norm. And as a result, what do we have to do as a system to plan for it? So I appreciate Ms. Conant bringing that up. And I just wanted to let you know what we're doing about it. But again, it's a situation that when you talk about those types of cases, every case in the system is important, but what you're talking about, Matt, is the most important. You're protecting kids, trying to help families. The resources are great. And so we'll be back on that, but just something that I wanted to add to. Thank you.
Thank you so much. Okay, no further questions for our public defender. Okay, next item on our agenda is our coroner. Mr. Russell, good morning.
Good morning, everyone. Hopefully you got the stats. Did everybody get the stats from December? Should be in the packet? No? Yes? Okay, good. As you can see, death is alive and well. I hate to say that, but it is the truth. In 2019, we had 299 cases in the month of December, and then last month, actually, we had 425. So it is a trend, obviously, with COVID, and not only COVID, but I have a presentation that I'll show you that COVID only accounts to about half of the extra deaths that we've had this year. We've had about a 30% increase in overall deaths from this year to last year, or from 2019 to 2020, let's put it that way. We had 136 COVID deaths in December of 2020. I know it sounds shocking, but as they come in, it's unbelievable. It seems like every day we'd get, several, and so we had to deal with those. Any questions on the office or the stats or anything? Okay. Well, I want to let you know that I'm going to take the next 11 months, each month, and I'm going to talk about a different aspect of the office, because there's a lot of different aspects that most people don't know unless they're actually performing the job. And but there, I look forward to working with this board, these individuals. The collaborative environment that we have is phenomenal between the state's attorney, the sheriff, all of us, the circuit clerk. The collaboration has just been overwhelming to me, because it's been a little bit different of a show for me. So I truly appreciate everybody's help and guidance and ear to listen to what it is we do and our needs as the sheriff. Thank you so much, Sheriff, for the vehicle and whatnot. So, but I want to talk about this resolution now, if that's okay. And obviously, it's a sizable considering our budget. But hopefully I'll be able to explain. And if you have any questions, feel free to ask either during the presentation or afterwards.
Mr. Russell, if I could just go ahead and entertain a motion and a second to discuss the resolution. Moved by Mr. Sanchez, second by Mr. Brown. Okay, please go ahead.
Okay. Oh, okay, next slide. We have three key factors of the reason why the shortage occurred. And I've listed them there, but I'm going to go through them one by one. I try to keep things to 3 short points, because I realize I'm the last on the agenda, and the last thing you want to hear is a bunch of numbers and stuff. So, but for those of you that are numbers people, every single invoice, every single dollar that is spent, obviously within the coroner's office, is tracked. Obviously, is under review and that kind of thing. So you can look through, the types of expenditures that we've had in detail. Again, we had a shortage that was given from 2019 to 2020. We had a sharp increase in overall debt that I'd already mentioned. And of course, I'm not going to blame everything on COVID-19, but it obviously was a factor in our budget. So next slide, please. Give you a little bit of a history of our budget and how and this is again, the actual amounts or the actual cost that it took to run the office. We got $1,050,000 in 2016, $1,069,000 in 17, 18 $1,096. 2019, we had $1,188,000 to end the year out. Obviously, that's a slight increase every year, 1 to 5%, something like that. But in 2020, we were given $1,020,000. Now, and again, these are all from New World and from the CAFR and everything. So, but basically, you go to the next slide. What I'm showing here is that we were already given 167,970 less in 2020 with the assumption that the coroner's associated costs would go down. History obviously did not indicate that. So we started the year 167,000, 168,000 less than what we ended 2019 at. So, and again, we have union contracts, built-in raises. I mean, the toxicology companies always charge more. The forensic pathologist expects a little bit of a raise, you know, that kind of thing that we just don't have much control over. Not to mention the amount of death, but that's next. Go ahead. We also had a sharp increase in our deaths. As you can see, I started everything at 3,000, and I'm not trying to be pull a fast one here or anything or deceptive, but basically the past 8 years that I've been here, we've averaged, on average, between 3,000 and like 3,300 deaths a year. Last year we had over 4,100 deaths. Now, of which only about 500 of them were COVID deaths. So we're up in all death, including just everything from heart ailments to suicides to car crashes to whatever you can imagine. Next slide. Obviously, more deaths equals more investigations, and more expenses and resources have to be expended to do it properly. Autopsies in 2018, we had a little under 250. In 2019, we had just a little over 250. So we figured around 250 would be around, but last year we had 327. And again, most of your COVID deaths, we did not autopsy because there's really no need. If they've been under a doctor's care, but these are other deaths that we've had to autopsy. That would include homicides, would include car crashes and things that involve a civil nature. We have to do it. It says in the statutes that when an autopsy should be performed is when if you cannot definitely determine, and this is straight from the statutes, if you cannot definitely determine a cause and a manner of death without the autopsy, then it is in public interest that an autopsy be performed. That's why we take that seriously. And if we say we cannot definitely determine it, it could be something else. So we have to do it. The graph to the right are all the other different types of expenditures that we have. And I'm going to blow them up one by one. So go ahead. First one is your salaries and benefits. I mean, obviously that's pretty much relatively fixed because it's by union contract. However, now benefits I have nothing to do with. That's all negotiated by the board. But the salaries, part of that would be overtime. And actually in 2020, we were up a little bit, but considering, what we had to deal with, I really don't think that was too out of balance. Go to the next slide. The contractual services. Now we're talking about, these are the services, the professional services that we need. The autopsy consultant, toxicology, there's specialized things, forensic odontologists, there's forensic anthropologists that we just used in December. There's all different kinds, special heart and brain and all different kinds of, but the vast majority of this is going to be the autopsies that we have to, perform. And obviously that went up significantly because our autopsies went up significantly. So go ahead. Last one is the commodities. That's the things we use every day. Our gloves, our masks, our bunny suits we call them. Different disinfectants. Anything you could think of that a coroner's office would need. Obviously, we went a little less than 10 times what we did because we were double bagging when it came to body bags is another one. When it came to a COVID death, we had to go pick up a COVID death. We were double bagging. This was obviously before we were getting a lot of the things from the CARES fund. We've got a few things in that have helped us, reduce some of the costs of double bagging and whatnot, but it's still, we had to put a body, because I want to keep my people safe. And we have to, we double glove. Everybody or every COVID body we went on, we had 4 people. We had a clean of 2 people. We called them the clean team, and we had a dirty team, and the dirty team went in and did all the work on the inside, and then they would hand off to the clean team. So there's a process to this. Basically what happens now is our commodities went up. So next slide. Lastly, is we had obviously the pandemic. We had about a little over 500 in December, up until December, from March into December. Since now, I think we are well over 600, almost approaching 700. Again, most of those deaths were not autopsied, but the investigation still had to be performed. Many of these deaths were unclaimed. That's another issue that we're having. A huge issue is that families are not claiming their loved ones. And what does that do? It puts us in a position where, and I personally have this program that I look at, that we pay for. And I don't want to have access to it for privacy issues. I want everybody to have access to it. So I do it myself, where, we look for next of kin, and several ones that I run, it says no known relatives, no known relatives. So there are relatives out there, but most of the time, but they don't claim them, and some of them are hard to find. So what happens is we're stuck with the bodies. We work with the state's attorney. We show them our due diligence that we tried to find next of kin, and then we do a proper disposition, which is a cremation, and then we put the cremains in a crypt every other year. So if anybody wants to gather their loved one, they still can. We had much extra PPE, obviously, to keep our employees safe. There was overtime that was required to process safely, effectively, and timely. Timely is important because we're dealing with funeral homes. We're dealing with many other entities. The police, they're there. They want to eventually go home, so we have to do our thing and get out of there. We had only, out of all this pandemic and all the different things we had, we only had 1 employee that contracted the disease, and he was asymptomatic. But we did have others that were suspected to have it, so we had to put them on quarantine, especially early, because that was the way we were told to do it. But what did it do? We're a small office, of 9 employees, so it created overtime, to cover the different shifts. And again, we claimed what we could for the CARES fund, but still it created others. Next. In conclusion, this is it. So again, I want to keep it brief, but the 2020 budget was reduced by 168,000. We spent, 168,000 more in 2019, but we were given $168,000 less, which was basically an assumption that, the assumption was that the costs would go down. Well, history did not show that. 2020 also produced a sharp rise in overall deaths, about a 28%, almost a 30% increase. And then we had the COVID-19 pandemic. It also created a lot of budget issues. Again, all this information, the detail, I want to give you the 38,000 foot looking down view of this. Any of the detailed information that you want, corner to corner. I mean, it's all there, but with the finance department, the treasurer, the auditor. And I just wanted to remind everybody that we're one of only 3 agencies that are accredited coroners, agencies that are accredited coroners or medical examiner in the entire state. So we're doing things the right way. And we're really trying hard to hold the line on the budget, but it's difficult when all these things are thrown at you. So that's all I have.
Thank you, Mr. Russell. Any questions for our coroner? Mr. Sanchez?
Coroner Russell, with all the extra deaths this year over last year, some are attributed to COVID. Do you know what the breakdown is approximately of what the other causes are? Is there anything that sticks out, or is it just everything?
Yeah, it is a little bit of everything. And obviously our reports follow, about 3 months behind the actual date. So we're looking, in February to have those numbers finalized. But clearly we had another record-breaking overdose year with opioids. I think suicides are up a little bit. I don't think they're up dramatically, but I think they're up a little bit. So it is a lot of different things. We had 2 homicides in December. So And then those are expensive forms of death. I hate to, looking at it from a administrator's point of view, somebody who passes away, it's all tragic, but somebody who passes away in the hospital, 95 years old, from natural causes, I mean, it's tragic and we hate to lose the person, but it's a less expensive form of death to investigate because the doctors have been on top of it the entire time. We just get the medical records, we read them, and we're able to determine the cause and manner from that point. But when you get homicides and you get, opioid deaths, I mean, there are just a tremendous amount of resources that, and we're up in all of it. We're up in all of them. So I'll have those numbers in about the next month, hopefully. We'll have those finalized and you can see, exactly where they were.
Thank you.
Madam Chair,
Thank you. Yes, go ahead, Mr. Shepro.
Mr. Coroner, how does the number of autopsies, did they increase commensurate with the increase in deaths or more or less?
Proportionally with the increase in deaths. Obviously, like I said, the vast majority of our COVID deaths were not autopsied. There was really no reason to do them. So, but other deaths, obviously the ones that I mentioned, probably half of the increase, several of them needed to be autopsied. So I think it's proportional with the increase of overall deaths.
And just a follow-up, how often do you go out on a call with good information or bad information as to what you're going to find at the other end in terms of people being infected?
Often. We have actually, and that's another increase in cost, is that we had been, in the early stages, we wanted to know, because I asked this actually on a national call that we had, I was on, and I said, how are we supposed to know, first of all, are these bodies as contagious after they pass away as they are when they're alive? And I really couldn't get an answer on the national level about that. So my next question was, well, then how do we know that a body is or not? And of course, the universal answer is, well, treat everyone like it is. However, there's a lot of resources that are involved, in doing that. So what we were able to do is, obviously we talk to the family, to the physician if there is one and whatnot, and try to get some symptoms. And then we would actually test the person. And then we would send that test to a lab at CDH, and they would let us know sometimes quicker, sometimes a little longer, depending on where we were at in the actual pandemic, with the numbers rising. If it was a lower, if we were in a lull, we'd get them back within a day. If it took a little longer, it would take a little longer if we were up in numbers. So it might take as long as 3 days to find out. So, and again, that would determine whether or not an autopsy was needed to be performed. If you've got a 51-year-old who had symptoms of COVID and was being treated but was never tested, we needed to test them. And what we would do is we'd test them and hopefully it would come back. And if they didn't have COVID, then obviously we have to open that 51-year-old up and look inside, because we don't have x-ray vision. We don't know what's going on inside. So a lot of stuff at play. It's been a very tough year. My employees have been phenomenal through this whole thing, have placed themselves in harm's way, have done it graciously, and just, I've been there with them. I've been to many of the calls. I go to many calls, but obviously I can't go to every call. It's just impossible. That happens 24/7. But yeah, I can't praise my employees enough for the diligence and the work that they have done under tough situation.
Thank you. And I think our state's attorney had a question.
More a comment. I just wanted to say that, given the statistics I said earlier, the national studies that are being done are showing that there is a rise in our homicide cases, and they think we're going to see higher numbers than we ever had before. In Kane County, just in December, we saw a murder case. We had 2 attempted murder cases and a murder-suicide that were all domestic in nature. The coroner's office has been fantastic in regards to the response that they've been giving, as well as the information that they've been giving to my office for prosecution of the cases that they were out. Coroner Russell has been available for phone calls, has gone to scenes, has done everything that he can with his employees. So I want to commend him and say that they have been doing exactly what we asked them to do, especially given the rise in this. I 100% agree with him that we are going to see more deaths. We are going to see a lot of these being related to domestic violence issues because the pandemic has everybody together. So I just wanted to echo what he was saying because I think that his concern that everything is just going to increase is 100% correct.
Thank you. Mr. Leonard, go ahead.
Thank you, Madam Chair. I just want, on a personal note, I wanted to thank Coroner Russell and his staff. My elderly father-in-law died of natural causes last month, and your staff treated my wife and her family so well and so professionally and so thoroughly. And there were follow-up calls too, that even in a natural death, I have to say, my wife and I were very impressed from a civilian standpoint, not being involved, at how professional your office handled things and how compassionate they were. So I thank you and your staff very much for all you did.
Thank you. I appreciate that. I love to hear that because then I know that we're doing the right thing. And that's really what it comes down to. If it translates down to the civilian level, I mean, that's exactly what I want. I want to make sure that the people, all people, are taken care of the proper way under dire, it's never easy. No matter if it's a person that's been around a long time and had a nice long life, or if it's a tragic, situation, it's never an easy circumstance for the families. And I've told my people time and time again, I mean, you don't have a right to have a bad day. I mean, these folks that you're dealing with, they've already taken the cake on that. They've got a bad day. Whatever issues you have, set them aside for 20, 30, 40 minutes and show them your best. And they do that. And that's why I'm so happy with them and why I praise them here today, because they are great people.
Thank you. And my condolences to your family, Mr. Leonard.
Oh, thank you, Madam Chair.
And this resolution has been vetted by the financial department. I know they've worked closely with you on trying to make sure we got funds from different areas. So it's, I'm confident that we've done our best here, and hopefully we'll do better next year when it comes to our budgeting process. Any other questions or comments on this? Once it's passed here, it will go to finance in a few weeks. So, okay, no further questions. Please call the roll.
Brown,
Yes.
Gums,
Gums, yes.
Leonard,
Leonard, yes.
Sanchez,
Yes.
Shepro,
Shepro, yes.
Davist.
Davis, yes.
Passes.
Okay, thank you. Passes. All right, there is no need for executive session this morning, so I'd like to entertain a motion to place all written reports on file. Moved by Mr. Sanchez, second by Mr. Leonard, and we'll take a roll on that.
Yes.
Gums,
Gums, yes.
Leonard,
Leonard, yes.
Sanchez,
Yes.
Shepro,
Yes.
Davist.
Davis, yes.
Thank you.
Okay, thank you. Okay, does anybody have any comments or any further discussion from our committee before we end the meeting? I guess I'll just reiterate that I know that the criminal justice reform bill kind of came on suddenly, and it's kind of like a book club. We'll all be reading that over the next few days. So if there's anything that, I guess I'd open it to any department, anybody, any directors, if there's anything directly related that they feel that we need to act on, please email me and the rest of the committee. I think it's important that we keep an open discussion on how it'll affect our county. Okay, so other than that, I'll entertain a motion to adjourn for this morning. Moved by Mr. Sanchez, second by Mr. Brown. And that is a voice vote. So all those in favor?
Yes.
Aye.
Those opposed?
Aye.
All right, thank you so much, everybody.